everyone. This is Dr. Live with New Insight, and thank you for joining me in another video. In today's video, I will be discussing 4 important insights you must know about trauma. Understanding these 4 key points will help individuals make a more informed decision about addressing their trauma and help them to set realistic treatment expectations if trauma therapy is needed. Number 1. Understand that not every problem, issue, concern, or mental health condition is related to trauma. Sometimes people think there must have been something really bad or traumatic has happened in their lives, and this belief has been formulated due to various reasons. For example, they may feel depressed, at a disadvantage in life, they've experienced trials and tribulations, may have heard speculation from family, or have a family history of dysfunction or intergenerational trauma. And because they are uncertain, they want to explore this in therapy. Although they don't have evidence or proof that something traumatic has happened, they would like to determine if there has been. And the problem with this is your mind will start to gather evidence to support your claim, which may not be based on factual information. And this is known as confirmation bias. And you then become so hyper-focused, and for some people, even obsessed, with believing something traumatic has happened until you lose perspective on other issues that may warrant your attention. This also creates and worsens anxiety, confusion, frustration, and stress, which causes your mental health to decline, affecting how you function in other areas in your life. And now, as a result, you have more issues to address in addition to possible trauma. Number 2, if there is trauma, there are ways to address it without revisiting each and every timeline of events from the past. This can cause distraction on minute details that may or may not be relevant to the main or core issue and can cause you to become stuck and even re-traumatized. Number 3, there are times when addressing trauma does not warrant clinical intervention. It doesn't mean that the trauma is not important and that you shouldn't talk about it and process your thoughts and feelings. However, it may not require clinical attention depending on several factors, such as the level of impairment it's causing in your life and your symptoms. There are times when an individual can heal from traumatic events on their own by using their protective factors, such as having a positive support system, finding creative outlets, for example, through art, music, or writing, reprocessing their trauma to turn the pain into power and purpose, mentoring, advocacy, and by developing their own personal strength, resiliency, and coping skills to gain a healthier perspective on their life. Number 4, if you are seeking closure from trauma, carefully consider what closure means to you so that you don't have unrealistic expectations. Oftentimes, people seek closure but aren't certain what this means. And because they don't know, the ambivalence and confusion causes more anxiety and frustration, creating distraction and hindrance in their life. Don't spend so much time in the past that you can't focus on your future. And don't become helpless to your past, allowing it to define you and dictate your quality of life. None of us can change the past. However, we can learn, grow, heal, and reinvest in our lives so that today, tomorrow, and the future can be different. Understand that oftentimes the only closure from the past is to let it go and leave it where it is. And not in an invalidating way, but in an empowering way. Understanding these facts about trauma can help you gain more clarity about whether or not you have trauma, how it's impacting your life, and to what extent. It will also help you determine if clinical attention is necessary. So don't suffer in silence and always seek help if needed. Thanks for watching, and I'll see you in another video.